So I want to show you how scientists would set up what we call a Kirby Bauer or a disc diffusion assay. The point of this assay is to allow clinical laboratory scientists to test a patient sample against known concentrations of antibiotics. The first part is pretty straightforward. We'll make a lawn of our bacterium of interest, and then we will place antibiotic containing discs on that lawn. We'll let it grow overnight, so of course we'll have to come back tomorrow to interpret our results. This is one method that scientists in a clinical lab setting will often use in order to, again, test the susceptibility of a particular bacterium to a particular antibiotic. So what we do is we take our bacterium, we've got a bacillus isolate, and we'll take a sterile swab. Dip that sterile swab into our bacillus culture, get our swab nice and full of bacillus, and then we will make our lawn. Just to be on the safe side, I am going to use a second swab to really ensure that I have a nice lawn of bacteria so that I can easily see what's going on tomorrow. Okay, so I have my lawn of bacteria plated on my plate. I am going to label my plate by cutting it into 4 even sections. Well, not so even. I'm not the best artist, but that's okay. So the next step is we are going to take discs that are already saturated with our antibiotics. So I have some forceps. I'm going to make sure those are sterile. This antibiotic is called meropenem. And so what I'm going to do is use my sterile forceps to push out a disc that contains, this disc in particular contains 10 micrograms of meropenem. The disc is labeled on one side. I will put that on my lawn. And so what I'm going to show you when I'm done is what the lawn looks like. I'll choose another antibiotic. This one is ampicillin. So again, I'm pushing the disc out. I've got my disc, and what you do is you place the disc on the plate and you push it gently down on there. So that's what I'm doing every time I put a disc on the plate. So I've done meropenem, I've done ampicillin. The next antibiotic I'm going to select is ceftriaxone. So ceftriaxone, I will pull the disc, putting it on the plate, pushing down like I showed you. And the final antibiotic I'm going to choose for this is bacitracin. So bacitracin, pop out the disc and put it on the plate. And now what we're looking at is all 4 discs on the plate. You can see the names of the antibiotics and their concentrations. We'll put a lid on it, flip it over, and this plate is good to incubate until tomorrow. So our disc diffusion or Kirby Bauer assay from yesterday is all done. The culture on the plate, the lawn, looks kind of weird. I think I did not let the plates dry long enough, so we have a little bit of condensation on the plate. But we can also see some zones of inhibition and some where there are no zones of inhibition. So I will take my ruler and measure the zones of inhibition. What we can see, interestingly enough, is that with ampicillin, and with bacitracin and with ceftriaxone, there is no zone of inhibition. The bacteria were able to grow all the way up to the disc. What this means is that this strain of bacterium is resistant to ampicillin, bacitracin, and ceftriaxone. However, what we see surrounding meropenem is what we call a zone of inhibition. There is an area around the disc where the bacteria were not able to grow. What this means is that, at least at some level, these bacillus might be sensitive to meropenem. But in order to classify that, we first have to measure that zone of inhibition, and then we will compare it to a standard. And I will include the standard in the video and how to interpret that standard. So I'm going to take my ruler, and using, of course, the metric system, we always measure in millimeters when we're measuring zone of inhibition. I would say, I try to measure it at the widest part. I would say that the zone of inhibition to me looks to be about 25 or 26 millimeters. I'll measure it one more time, right? Measure once, you're in trouble. Measure twice before you cut. So we'll measure twice. Yeah, about 25 millimeters. I'm pretty comfortable with that. So what I will show you next is how to interpret the zones of inhibition. So remember, ampicillin, bacitracin, ceftriaxone have 0 inhibition. Meropenem, 25 millimeters. Here is another Kirby Bauer disc diffusion assay for you to work on interpreting. I will hold the ruler up, and I'm going to ask you to read the ruler and then use the table provided to interpret whether or not this species of bacterium is resistant, intermediate, or sensitive to the antibiotics. So the first drug, D, is doxycycline. So I'll hold up the ruler. You're going to read it and interpret. The next antibiotic is K. It's kanamycin. I will hold up the ruler. Let me get it lined up. There you go. The next antibiotic down here is gentamicin. And our final antibiotic over here is ciprofloxacin. So based on the diameters that you read from the ruler and the table that I've provided to you, can you tell whether or not bacillus is sensitive, intermediate, or resistant to these antibiotics? Here is a final plate for you to interpret. As we can see, the 2 antibiotics on the left, the bacterium was completely resistant. C is going to be chloramphenicol. CC is clindamycin. VA is vancomycin, so you can interpret based on the table. So here is your standard gap. Okay. Rifampin, it's kind of weird. You can see this overgrowth in here. That's probably because only of the condensation. So I'm gonna hold out and you'll read the diameter of this largest part for rifampin. And again, based on your interpretation, is this bacterium sensitive, intermediate, or resistant? So what we're looking at here is a table of the various antibiotics, and then 3 categories: sensitive, intermediate, and resistant. So basically what you'll do, once you measure your diameter and you have that in your mind, you'll go to the table and you'll see, okay, is my diameter greater than this number? If your diameter is greater than or equal to the number in the sensitive column, that means that your bacterium is sensitive to the antibiotic. The other option on the right-hand side is that your diameter might be smaller than this number. So if your diameter is smaller than this number, that means that your bacterium is resistant to the antibiotic. Now, some of the antibiotics have numbers here under intermediate. What we're talking about when we're talking about intermediate is that clinicians still feel like the drug has clinical relevance. However, you may, as a physician, have to prescribe a higher dose of the drug in order to get the same effect. So if the bacterium were sensitive to the antibiotic, you could prescribe one dose, but because you're in that intermediate range, you now have to prescribe a higher dose. If the bacterium is resistant, you would not prescribe that drug to the patient for treating their infection. What I'd like you to try using this table is to go back and remeasure those other zones of inhibition that we talked about and fill in whether or not you think the bacterium is sensitive, has intermediate, or is resistant to the other drugs.